Good day to everybody. I'm Dr. Shobana Mohandas. I would like to speak to you about fever in pregnancy, which is a controversial topic to many people and creates a lot of apprehensions in the mind about it. I come from Thrissur, Kerala, and I'm a gynecologist. Well, basically, there is fear of the disease and fear of the drugs. Mostly, it's fear of the drugs for everybody more than the fear of the disease. Because we have been seeing fever from our childhood, it just comes and goes, and that's scared of it. The minute you take drugs, you're worried if the baby is going to be affected. Having said you should be worried about the fever and not the disease, I should also assert that not all feeling feverish is not always fever. Only if the thermometer shows the temperature more than 99, then only it can be called fever. Because there is a hormone called progesterone which makes you feel hot, but it's not really fever. There's a lot of increased blood circulation in the skin that is again makes you feel hot, but there is no fever. So if and only if there is fever, you have to be worried. The commonest cause is virus and influenza. Little bit gastroenteritis, uterine infections, kidney infections, and unknown things are there. But most often it is upper respiratory tract infection, initially caused by virus and later the bacteria. So, if you have a temperature taken 2 times apart, 2 hours apart, which is 37.5 degrees Celsius, then you have to consult a doctor. If the temperature taken is more than 38, then even one take reading is enough. And there you have to take medical treatment. When will it affect the baby? Not all fevers are going to affect the baby. Only if it is more than 102 degree Fahrenheit or 38.9 degree, 2 or 3 times in a pregnancy, then only it can affect the baby. A brief fever episode and it's got off with medicines, no, the baby won't be affected. Don't get worried. Basically, if such a high fever occurs even before pregnancy, 2 weeks before the periods are missed, up to 1 week after the periods are missed, which is the implantation phase. If these fevers come in high grade at that time, the baby won't sit inside the uterus, it won't implant, and there will be an embryonic death. And the organs are found between the 1 week after the periods are missed to 8 weeks. And if that time, if you have major fevers, then the baby can have CNS, skeletal, neuromuscular, or cardiovascular defects. But reiterating, if it is treated, there is no problem. 8 weeks onwards, there can be growth retardation and functional defects. Like the baby can become stop growing fast. There can be decreased water or oligohydramnios. It can deliver fast, like 7 months, 8 months, or whatever early pregnancy can happen. Early labor can happen. Fetus can get distressed and can have anomalies, and abortions can happen. And recently, there is a Association of Autism Birth Control study, which has found that if there is fever 2 or 3 times after 12 weeks and it's not controlled, it can even cause autism in the baby. So, and in those patients who had this problem, the autism was much, much less in patients who had taken paracetamol for the fever in the second trimester. Some people get scared to take the medicine and go on procrastinating, and there the babies can even get autism, so don't get scared of medicines. Chickenpox in pregnancy, again, people are worried of drugs, but although theoretical risk of acyclovir is there in first trimester, basically it is definitely safe in pregnancy. By itself, the defect with chickenpox to the baby is 0.5 to 1% in the first trimester or 2% in the 13th to 20th week. But in my practice, people who have opted to believe that they remain in the 99%, they definitely do not have any problem. They never had any problem, and I have delivered a few patients who had chickenpox in pregnancy without any congenital abnormalities. So some of them had little growth retardation, but that happens in every fever, and we are able to manage it with medicines and drugs, and there is good outcome for the baby. Again, X-ray in pregnancy, people are very worried. With few exceptions, radiation exposure, radiography, CT scan, all these, the amount of radiation that is there in these uh, procedures, it's much lower than the exposure associated with fetal harm. So, if these techniques are necessary in addition to ultrasound or MRI, it should definitely not be withheld from the pregnant patient. That is what the American College of Obstetricians and Gynecologists are saying. In fact, from those in Japan, when they had the bombing and radiation because of the atom bomb, that's where they found out that people who had up to 50 to 100 mgy radiation in the pre-implantation phase, 200 mgy in the organogenesis phase, all these radiations caused abnormalities. But when you come to the ground reality, this 150 and 200 do not happen with a normal chest X-ray, because the amount of radiation there is only 0.06, 0.07, or even zero point 0.1. This cannot cause abnormality. So if you need a chest X-ray or CT to diagnose something in a woman, and that is the only way to have a diagnosis, then this modality of investigation should not be withheld from the patient, and the patient should not get scared of getting the X-ray done. It's better not to have fever in pregnancy. So go wash your hands often, sanitize your hands, avoid close contact with people who are sick whenever possible. It's possible to get the flu shot in pregnancy, and it will create antibodies which are passed to the fetus. So even the fetus after delivery in the immediate period, till it can take the flu shot, can be protected from influenza. So it's good for the baby also if the mother takes a flu shot. Use a mask in crowded places. Avoid going to crowded places like, uh, conference halls or cinema theaters or weddings or wherever there is a big crowd. It would be better for pregnant people to keep away from places so that they basically don't get the fever. And if they do get the fever, in addition to medicines that the doctor prescribes, stay in bed and take rest. Use cold sponge or something like that. Drink lots of fluid, because the fluid will go inside and cool down the inner parts of the body. Monitor your temperature often, because if it is more than 102, we all know that it's going to cause embryogenesis, harm to the baby. So we have to be monitoring ourselves. And if there are sudden changes, inform the doctor. There are some reports that paracetamol is not safe in pregnancy, but this paracetamol is unsafe only if taken for more than 20 to 30 days. That is, people who have pain in the head or any part of the body, they go on popping paracetamol. That can cause autism. Short-term use of paracetamol for fever is certainly safe and should be resorted to, should not be withheld. And there are many antibiotics which are safe in pregnancy. You should not worry about antibiotics if they are prescribed by a doctor in fever. So we know that in spite of all the campaigning, only 50% people take the influenza vaccine. And pregnancy, definitely, you are definitely going to end up with a more severe illness, because the immune system is very uh, compromised in a pregnancy. So what is the way out now? The way out is you can take, if ever you get a flu-like symptom, you can take oseltamivir. And if this is taken within 2 days of having flu symptoms, it will not go into the severity phase. So women who have not been vaccinated, whenever they get a fever and they have flu symptoms, do not procrastinate. Please go and take oseltamivir under guidance of a doctor. So, in short, feeling feverish is not fever. It does not need treatment. Actual fever should be treated. Infections can harm both the mother and baby, and the medicine should not be scaring to the patient. The infection should be. Only antibiotics safe in pregnancy are prescribed by doctors, and they are certainly safe. Paracetamol for fever is safe. Oseltamivir should be taken for flu-like symptoms. It is good to take the flu vaccine in pregnancy. I hope this information has been useful to you, and thank you for your patience.